Welcome to our show Health Mantra with Esha. Today I give you a little information about Ayurveda. Ayurveda is a science of life and well practiced in India for thousands of years. I heard about Ayurveda from my mother. She was used to home remedies that came from Ayurveda. In my childhood, I suffered from migraine. I used herbal remedies. My migraine, it was harrowing. Ayurveda is one of the oldest health treatment systems in India. In the Western world, Ayurvedic treatment is slowly getting popular as a remedy for relaxation, dietary choices, lifestyle changes, for everything related to your body, mental health, and your spirit. If you want to get experience some of Ayurveda in St. Louis, Hands, Heart and Soul is the best option for you to have this experience. Hands, Heart and Soul in the St. Louis area is an Ayurveda spa providing services to support your mental, physical and emotional health. Andrew Nunnberg is the owner of Hands, Heart and Soul. He was the first introduced to yoga and meditation in 1998 and received his first Ayurvedic treatment in 1999. Andrew is a certified trained instructor in mindfulness and yoga through the Art of Living Foundation. He has been teaching various classes and workshops for the past 15 years. So, let's check out the interview I had with Andrew.
We'll be right there with you.
Andrew, welcome to our show.
Thank you for having me.
Ayurvedic treatment is one of the oldest remedy in South Asian country. Now it is slowly getting popular after yoga in the Western world. How are hands, heart, soul connected with Ayurvedic treatment?
I set up my practice primarily to expose people to these treatments. Ayurveda is becoming very popular in the West. I think most people know it more about lifestyle management and maybe herbals, but a lot of people don't know that there are actually treatments you can also get in connection with Ayurveda. And so part of my training, I started to work to become a massage therapist because in many states you need what they call a license to touch. You have to have a legal sort of context to touch people. So if I was a health care professional like an RN or a doctor, I could do this. But for me, since I don't come from that background, I became a massage therapist. And along with that training, I went for a 2-week residential program in Quebec through the Art of Living. And I learned not just the treatments, I learned about 4 treatments, but also some of the Ayurvedic theory behind it. So when a client comes in, I do a little bit of assessment. And then I decide within that treatment either what oil to use or some other modifications to suit their needs.
What is your basic philosophy of health, disease, and treatment in Ayurveda?
So Ayurveda looks at the whole person, first of all. So it's a holistic approach to health. And health is not just the absence of illness, but also the absence of harmony within not just the body, but also mind and spirit. So in Ayurveda, we are always looking at not all these 3 things: how the body is functioning, how the mind is, how the feelings are. So dis-ease happens when there is this disruption of this harmony. And in Ayurveda, we talk about these 3 main biological forces called the doshas. So Vata, Pitta, and Kapha. When these become out of balance, and everyone has these 3 doshas, they just have them in different amounts, and their interplay is a little different for everybody. So disease happens when there is this disruption in this sort of normal dynamic tension that's normal for you. It gets a little more complicated because there's doshas, there are the seven dhatus, the tissues, there's all these different things. But to sort of simplify it, disease is a disruption in this harmony. So to get people back into harmony, we do Ayurvedic treatments, we make changes in the lifestyle, some herbal remedies. So these things take a little time. They take more time than in Western medicine.
I have seen Ayurvedic treatment on the website. When did you start providing Ayurvedic treatment?
Started offering treatments in my practice in March of last year, which unfortunately was the beginning of COVID. So I do take all the normal precautions, masks for myself and for the clients. Fortunately, because my regular day job is in healthcare, I recently got my first dose of the vaccine. So this makes me a little more comfortable with people. And also some people are not comfortable coming in at this time, and that's okay too. But I do have some clients that are comfortable with all the precautions. So I've started in March, and I have already some regular clients who come in for regular Ayurvedic treatments.
As an Ayurvedic technician, how do you approach complex health issues to treat through Ayurveda?
Because I'm a massage therapist, it's not my purview to diagnose people. So when people have an issue, I usually refer them to Dr. Neeb at HealthQuest, because as an osteopath, he's very familiar with Western medicine, and also he has training in Ayurveda, and he can actually give medical advice. So some of my clients are actually patients of his who are exploring Ayurveda as a way to better manage their health condition. So I find that working within a team of people is a much more effective way, especially with complicated issues.
What are the benefits of Abhyanga, Marma, and Svedna?
Abhyanga is a whole body oil massage. I like to think of it as a dance of oil on the body. And according to Ayurveda, it's really good for anti-aging. It's definitely really good for the skin, especially when it's dry outside. Our skin is our largest organ of the body. And in Ayurveda, oil is a very nourishing substance. So that it's really good for the skin. It's really good for encouraging toxins to move into the digestive tract. This becomes even more important when we're doing an Ayurvedic cleanse or detox. It calms down vata dosha, meaning it calms down movement. So when people are feeling a little restless, if the body is going a bit of spasming or lack of coordination, then Abhyanga is really good. And also it helps really release tension. It's different than a Western massage in the sense of doing like deep tissue work. I find that it works more through the nervous system. So the nervous system calms down so much that any tension that we're holding in the body gets released. I've had one or two clients with like frozen shoulder issues, and after one Abhyanga, they find that there's a little more mobility, even though I was not directly working on that area of the body. And the touch is very gentle. It's not like a deep, hard touch at all. So anti-aging helps with elimination of toxins and helps calm down the whole body.
And what about Marma?
Marma itself means hidden and also means vulnerable. So these are hidden and vulnerable points on the body that were first used in martial arts, and then they migrated into Ayurveda. So these different points with a beneficial intention give you positive results. And there are marma points that we kind of use all the time but don't know it. Like if we have a headache, what do? We rub the temples. This is called Chanka marma. So this is one marma point. And they correspond, many of them correspond to acupuncture points as well. So they are connected with the doshas and organ systems. So a marma treatment in Ayurveda is considered the most restorative treatment you can get. I call it a mind-body reboot. You just lie down on the table, and with just very gentle touch, we stimulate these different points. And when we do this, it initiates a positive chain of events. The experience for most people is quite meditative, actually. They report things like, I was asleep but not asleep, I was aware it was happening, but so we're in that in-between state of being awake and being asleep. It's really good in Ayurveda for nipping disease processes in the bud, so to speak. We have this expression, nipping it in the bud. Because in Ayurveda, disease starts with imbalance of the doshas. And marma helps restore balance at a very subtle level.
And tell me about Swedna.
Swedna is the heat. Most of it is with steam. And it's really good for when it's dry out or when you're cold. It helps balance that. So for most people in the US, a lot of their imbalances is with vata. And vata by its nature is cold and dry. So when you add something that's warm and moist, it balances out. Swedna is really good for helping liquefy the toxins and again encourage them to either move into the digestive tract or actually sweat it out. So what we normally think of as good for steam. My steam treatment is a little different because you're lying on the table and we have like a little tent that we put on top of you. And then we have the steam come in, and I use some essential oils depending on the particular imbalance of the client and what they need.
How do you convince audience towards Ayurvedic treatment over the Western medicine?
I make it a point never to convince anyone of anything. I found that it really hardly ever works. But what I do is I offer people something different. Here's an alternative. And the reason why Ayurveda is becoming so popular is because Western medicine is good for a lot of things, but it's not so good for other things. One of its biggest shortfalls is that it's not very good for chronic conditions. You know, the joke is if you're having a heart attack, you don't go to an Ayurvedic doctor and say, I have a heart attack, I'll give you these 3 pills, come back in a month. No, that you want to go to a Western hospital, and they have great interventions for an acute situation. Ayurveda really excels with prevention of illness and management of long-term conditions. So I think people are just looking for something, and Ayurveda is definitely one of those things. What I like about it, it has a 5,000-year track record. So it's not something that someone just made up and say, oh, I think this is good, do this. It's based on empirical data, people doing this for a long time. So when people are presented with that, they're open to at least trying it, once. Like, okay, come, see what this does for you. I've had clients who went through all my treatments and it's like, okay, this is the treatment that I really like, and now I know what this does for me. I'll come back for this. So,
if our audience wants to get in touch with you, how do they connect?
Probably the easiest way is through the website, www.handsheartsoul.us, or they can give me a call at 314-494-5042.
Thank you very much, Andrew. I really appreciate your timing.
Thank you for having me here.
So Andrew is vastly experienced in Ayurveda. His explanation about AnnBingham massage, karma, energy therapy, dojas, and the oil treatment were wonderful. We experience Ayurveda with Andrew. In my experience, yoga is another way to release stress and anxiety. Yoga is a mind-body practice that combines physical poses, controlled breathing, meditation, and relaxation. Yoga may help reduce stress, lower blood pressure, lower your heart rate, and almost anyone can do it. Yoga helps recover from trauma, injuries, and serious illness. So, we will be talking more with our expert, AnnBingham. Ann is the founder of Kula Yoga Collectivity. She has more than 20 years of experience and expertise in chronic pain and pain management through yoga. Ann has taught multiple styles of yoga poses to children and adults. She has launched a self-care project called One Thing New. So don't waste more time on chat here. Let's go to check out on her. welcome to our show. How are you?
I am great. Thank you so much for having me.
So, I'm really excited about this topic, pain management and chronic pain. So, today we talk about how yoga helps people with pain management. So, first of all, tell me about yourself.
Yeah, so I came to yoga about 25 years ago. I have a chronic pain illness myself, and like many people, a friend of mine suggested that yoga might help, and I found that it helped to alleviate some of my symptoms. A few years in, my neurologist said, so this is no longer a recommendation for you. This is now a part of your treatment plan.
Okay.
And I continued doing it. And as my illness progressed, I came to a point where I had to give up my 30-year teaching career. And I had been doing some yoga with my kids at our school. And my husband suggested, why don't you go ahead and get your yoga teacher certification?
Wow.
So I did. At the time, the plan was I was going to start teaching kids yoga. Well, when I left that job, I found that I really connected with people like me, people who didn't always feel comfortable in a traditional class setting, because in many respects, the yoga world isn't always set up for people like us. We often need a lot of accommodations, and we need things to be taught slightly differently to help us connect to our bodies the way that we need to. And so I started working pretty exclusively with folks with chronic illness and chronic injury, and that's sort of how I got to where I am now.
Your expertise in chronic pain and pain management. On the website, you mentioned pain management. What does pain management mean?
So pain management means lots of things for lots of people. And in the medical community, a lot of times that means we're going to give you pills for that, right? And for those of us who live with chronic pain, we're looking for a way to make peace with our bodies. We know that these conditions are something we have to live with. What we want is a way to be friends with our bodies again and to find the places that we're strong. And so what my approach is to use yoga through breath, through movement, and through intention to remind people that they're not at war with their body any longer, that they can walk alongside this illness or this injury and know when that illness or injury is talking to them, when it's trying to communicate with them, and when they need to listen. That's what pain management really means.
How do you help patients who suffer from trauma, injuries through yoga, especially chronic pain?
A really great question. So when our body is holding on to pain, when our body goes through trauma, then we tend to hold those things inside of our body, inside of our muscles. And here's why. Because we're not conscious of how we process those things. That all sits in our primitive brain. We go into fight or flight mode, and the stress that accompanies those things, that accompanies always being in pain or being in a traumatic situation, it sets our body up for trying to figure out how to keep us safe. So our body tenses. Our body is always prepared to fight and to run and to get out of that situation. And so because of that, specific places of our body, depending on what that trauma is or what that illness or injury is, tends to hold on to that memory, if you will. And so by working through that in yoga, in addition to working through that with a medical doctor or a mental health professional, it can help to begin to release the muscles that are holding on to that muscle memory, if you will.
What are the types of yoga poses that help you reduce chronic pain?
The types of poses that would help us to reduce chronic pain are specific to the kinds of injuries or illness a specific person would be working with. There are a few that are just general, are helpful in general. And those would be poses like the waterfall pose or Viparita Karani. It's a very gentle inversion. Your legs are up a wall, your back is down on the floor. It's a very restful and relaxing pose. Child's pose is another pose that is a very soothing and relaxing pose. Poses that twists tend to be able to get out a little bit of trauma, particularly because for women, we tend to store our trauma in our hips and lower back. Men tend to store their trauma in their shoulders and their stress in their shoulders.
That sounds really unique.
It's not unique. As Americans, actually, in the Western culture, we tend to store it in our shoulders. Okay. However, women tend to store a little bit more in their hips as opposed to their male counterparts.
What is the reason behind that?
One of the reasons, quite frankly, is because this is where sexual trauma tends to be held, and women tend to be victims of sexual trauma more often. So that's one of the main reasons. And when you're addressing things like sexual trauma in a yoga class, that needs to be done quite carefully. There's very specific language that we use. We don't use touch prompts at all. And there are props that we use and don't use. In my classes, working with folks with trauma of any kind, I tend to not turn the lights down, and I tend to be pretty careful about the music I use. Sometimes I don't use music at all, because I want to make sure that folks can really have a very welcoming environment and that they can hear things at all times, see things at all times.
Tell me about your classes.
I never come in with a set plan. I come in with a structure for the class. So we always start with a warm-up and some discussion about sort of how's everybody doing, how are our bodies feeling, and we always start with an opening grounding meditation so that we can really get in and feel how our bodies are feeling. And then the poses are taken from what people have told me. So if people are telling me I'm very anxious today, I just can't focus, then we're going to keep our class very low key. We're going to keep it working on balance poses typically, because balance poses are great for focus and great for sort of reducing anxiety. And then we'll move into our final relaxation, which again is really directed by what the folks in the group are telling me. My classes are small. So my classes, because of the nature of what we're doing, they are highly, highly individualized. We use a lot of props. We use a lot of accommodations and adaptations so that people can really feel what their body is telling them and really enjoy that moment. You know, a lot of us with chronic pain are used to not liking what our body is telling us. And we want them to really stop and take many breaths and really enjoy that lovely feeling when you get a good stretch.
In this pandemic, how do people reach out to you for help?
The easiest way is through my website. All of the information is there. My contact information is there. It's www.kulayogastLewis.com. That's Kula with a K, yogastlewis.com. You can also find me on Facebook and Instagram at Kula St. Lewis.
Tell me about your project, The One New Thing.
The One New Thing project is a part of Kula Yoga that is really cool. It's a way for for everybody, for folks with chronic illness and injury or not, to reconnect with your life and find joy in a really unique way. I started doing this about 9.5 years ago. And it started with the really simple idea that we can find joy by doing one new thing a month. Not something big. This is not a bucket list. This is not about skydiving or anything like that. Again, this is coming from somebody with a chronic illness. It's about figuring out ways to slowly step outside of your comfort zone and finding ways that inspire joy for you. So some of those things are, maybe you try a new cuisine, maybe you try a new recipe, maybe it's going to, right now in the pandemic, maybe it's you try a new hobby. For some people, it might be something really, really tiny. And for some people, they might want to try some really big, hairy, audacious things. But that's up to them. And it depends on what your personality is. And it depends on what your scope is. But it has been utterly life-changing for the people who've done it and tried it. That information is also on the Kula Yoga website, and that has a different place on Facebook and Instagram. That is my one new thing.
Wow, that's really, really sound great. Thanks, Ann, and really I appreciate your advices and suggestions for my audience. Thank you very much.
Thank you so much.
I am glad she shared her experience and project called One Thing New. I learned from yoga that was a powerful remedy. So feel free to contact Ann on her website. Both guests have super knowledge about their own field. Ann has explained about pain management, Andrew had explained about Ayurveda. If you are feeling stressed, I suggest you go for oil treatment because health is a wealth. See you next time. This is Esha Bargate.